Ladies and gentlemen, how many of you know or have someone with a thyroid disease or problem? The thyroid is a hormone-producing gland that is in the middle lower neck in this area. It regulates the body's metabolism, the rate at which it produces energy from nutrients and oxygen, and affects critical body functions such as level energy and heart rate. Most thyroid diseases are lifelong conditions but can be treated with medication. According to the American Thyroid Association, an estimated 20 million Americans have some form of a thyroid disease. The two forms of thyroid diseases are known as hyperthyroidism and hypothyroidism, and those are the most two common forms. Hyperthyroidism is a condition of the gland that produces too much of the thyroid hormone. The symptoms include irritability, nervousness, muscle weakness, unexplained rapid weight loss, sleep disturbances, vision problems, and eye irritation. It can be very serious if you ignore it, but most people respond well to hyperthyroidism once they are given medication. And the other one is hypothyroidism. Hypothyroidism is the opposite, because the thyroid gland does not produce enough of the thyroid hormone. The symptoms of hypothyroidism are extreme fatigue, depression, forgetfulness, and some weight gain. Most people and doctors refer to hypothyroidism as the hypothyroidism solution because once it is treated, it gives most people energy. The most common initial sign of a thyroid disease or problem is a goiter. A goiter is the swelling of the neck resulting from the enlargement of the thyroid gland. Goiters occur in both hypo and hyperthyroidism. So in my picture over here on your left, this is what a normal healthy thyroid looks like and where it's located, and this is how big it can get when you have a goiter. And this picture on your right also shows how small the thyroid gland is and how bigger it gets with the goiter. And these are two pictures of people who have hypo or hyperthyroidism. Since you know about the most common types of thyroid disease, you're probably wondering, how do you get a thyroid disease? Most thyroid problems and diseases are inherited, but that's not always the case. Most people are born with a thyroid disease and inherit it from their mother or grandmother. Although most people are born with the disease, symptoms might not show until childhood or even adulthood. For instance, I discovered that I had hypothyroidism when I was in 6th grade, but my mother found out when she was 42, and we had no idea that we had it before then. So it can show up whenever in your life. According to hypothyroidism, if a person in your family has hypothyroidism, there's an increased chance that you will have it as well. However, this could also mean that you will develop a different thyroid problem than relatives. For instance, my grandmother has hyperthyroidism, but passed down hypo to my mother, so that's why I have hypo, because hypo can only give to hypo, but hyper can give and pass down either hyper or hypo. The other cause of hyperthyroidism is called Graves' disease. Graves' disease is the swelling of the neck and protrusion of the eyes resulting from an overactive thyroid gland, which is what hypo or hyperthyroidism is. According to the Genetic Home Reference, in people with Graves' disease, the thyroid is overactive and makes more hormones than the body needs. According to the American Thyroid Association, Graves' disease only affects actually 1% of the population of people who have hyperthyroidism, so that shows how much it truly is inherited. Also stated in the American Thyroid Association, up to 60% of those with a thyroid disease are unaware of their condition. So it is very important that you get tested if you think that you have a thyroid disease or that you have similar symptoms or that it runs in your family. Undiagnosed thyroid disease may put patients at risk for certain serious conditions such as cardiovascular disease, osteoporosis, and infertility. In conclusion, thank you for watching my speech.